Let's talk more about the challenges facing a lot of hospitals still. Joining us right now, Dr. Jane Morgan. She's the Executive Director of Piedmont Healthcare COVID Task Force in Georgia. Doctor, always good to see you.
Thank you. Nice to see you, Fred.
Okay, so while there's some uplift and optimism in some places, still in others, hospitals are stressed. What is the situation in Georgia?
Yes, certainly we are seeing, as we're seeing in other parts of the country, some of these numbers starting to come down, but our hospitals are still stressed at or near capacity throughout the state of Georgia. And so we want to make certain that people are aware of that and absolutely don't use the emergency rooms to come and just get testing if you otherwise are not feeling unwell.
So we've heard, of some hospitals being forced to triage care, some saying they are running above capacity. How much longer can the overall healthcare system handle this?
In this fifth surge, that is really the great question. Obviously, this is a great deal of stress really on humanity, and physicians and nurses alike are a part of this humanity. However, we continue to stand and continue to treat all patients who are coming to our facilities, whether you're vaccinated, whether you're unvaccinated, and making certain that people can receive the absolute best care. One of the concerns that we have in this particular surge is that we don't have an adequate or a continuous supply of all of these new medical therapeutics that are being approved under emergency use authorization from the FDA. And so we want to make certain that the public is aware of that we do not have enough supply for everyone. So please make certain that you wear your mask and do your best to stay out of the hospital.
Yeah. We're starting to see, cases and hospitalizations fall, in many parts of the country. But does that give you any hope about, where hospitals might be in the coming weeks? There were so many warning signs that January is likely to be the worst as it pertains to Omicron, and perhaps things might get better. But, spring is right around the corner, and one has to wonder what might be around the corner as it pertains to COVID as a whole.
Fred, I am ever hopeful, and we are definitely seeing this begin to turn the corner. We are praying that this will be the last surge and that we will be able to move forward beyond this. We certainly look to South Africa, look to the UK specifically with regard to how it has peaked and how it begins to ebb. And we are tracking that the United States will also follow in that direction. But we should not let our guards down because on the way out, Omicron still has the ability to wreak a lot of havoc in its wake. So we must be certain that we continue to have our guard up, use home testing as a tool to help you protect yourself, protect your children, and make decisions about where you're going or who is coming into your environment.
Yeah, and hopefully, indeed, home testing will become much more accessible as people begin to get their packages after making those orders. So Georgia Governor Brian Kemp, he activated the Georgia National Guard to help hospitals with the surge. In what way do you see that making a difference?
So it certainly makes a difference as we offload some of the strain on our system. We have had quite a bit of absenteeism with our staff with regard to COVID positivity and having to isolate or quarantine, which means that even though on occasion we have beds, those beds aren't available because we don't have staff for those beds. And so hospitals, like every other industry in the United States, are also dealing with staffing shortages. And so the National Guard helps to offset a lot of those tasks that now people can be redeployed to help support our hospital system while we also deal with absenteeism.
All right, Dr. Jane Morgan, always good to see you. Stay well. Thanks so much.
Thanks, Fred. You too.
All right.